Hi, I'm Dr. Dobie Moser. I'm a parishioner here at Saint Ambrose, and I'm happy to be here with you this afternoon. Part of my being with you is to have a conversation and offer some reflections and resources, frankly, in dealing with the challenging topic of mental health and depression. It is part of our effort at Saint Ambrose. One of the things I love about our parish is that idea of Saint Ambrose Cares. And we care about people in a very Catholic kind of way, meaning mind, body, and spirit. It's not one over the other, it's not one or the other, but it's all those three integrated together. So part of that effort means that we're looking at this to say, how do we support families in meaningful ways as they deal with mental health challenges in their own families, individuals, and their loved ones? In our society, we have two different months. September is considered to be Suicide Prevention Month, and then every year in May, it's Mental Health Awareness Month. And we realize that mental health challenges and serious mental illness literally are a year-round reality. So we want to be mindful to say, what does it mean to support people as best we can as they go through these experiences? And it's important to note that with these challenges, they are hard enough to deal with. We would never want you to go through those experiences alone. We are here for you, and the support is not just in theory, but concretely, we want to be able to help you as best we can. So in this video, I'm going to introduce just a few different concepts that I think will assist you in understanding mental health challenges and what to do when you're faced with them. So I would just float the idea, if you or a loved one fell down and was injured, many of us would look and say, okay, initially if it's something that a Band-Aid or a drink of water when it's a young child, right away they shake it off and onward they go. But if it was a significant injury, we would not hesitate to get ourselves or our loved one to a medical facility to get treatment and help. And the very first thing that happens when they would go into that facility is an assessment. They would assess what happened, what is the injury, what kind of injury, what is the best form of treatment or response to that injury. So I float that idea because none of us would make that hesitation if it were an arm injury or a leg injury related to our bodies. And yet sometimes with mental health, because it's inside our bodies, and it's not always visible, although it sometimes is, but it's not always visible on the outside, we don't always have that same understanding. And it's important that we rethink that and say, just like we need a medical help and response when there is a physical injury, it's likewise very common that we need help medically when there is an issue, and especially a serious issue with mental health. So that is the way we want to think about it. Among the things that I want to give you in these videos, this is the first, is two important phone numbers that if you take one thing from these videos, it would be the thing to take. And that is, if you or a loved one or someone you know is in a mental health crisis in the moment, there is help at the county level with a simple phone call. And literally, they will walk you through what to do in that crisis. They are trained, they are excellent, and you want to know that number. So for Medina County, where our parish is located, that number is 330-623-6888. And likewise, that number for Cuyahoga County is 216-623-6888. I assure you, as one who has had a child with serious mental illness, we've used those services, and it is a godsend and a lifesaver at a critical time. There's a second benefit that we initially did not understand, but it's a very important one. In that crisis, when you call those numbers, you get documentation of whatever occurred. And that documentation actually is very important for getting services and help later. So don't hesitate to use that number. That's exactly why it's there. They are kind, they are non-judgmental, and they help you. You'll walk away knowing what to do and how to handle a hard situation. The second thing I would like to pass on would be the national organization that you want to be aware of. It's NAMI, N, capital A, capital M, capital I. and NAMI stands for the National Alliance of Mental Illness. So the way you want to think about them is they are your gateway to resources. When you contact NAMI, it literally opens up the options for finding out what kind of immediate services, what kind of medium-term or long-term services, what kind of education pieces are available, what kind of assessments. One of the real challenges with mental illness and serious mental illness is it's hard to tell exactly what you're dealing with. So parents and loved ones do their best and they begin to notice there's something here that is larger than I am. And what can I do to respond? Well, again, NAMI literally opens up a gateway of resources, including when you do have an assessment and do know what you're dealing with. They also connect with organizations, service providers who respond to those different illnesses according to the need. So NAMI, there's NAMI Cleveland. It's also in every city. If you look it up, NAMI, fantastic organization. They will open your door to resources and help, especially when so many of us, when we enter into this, are overwhelmed and we don't exactly know where to turn. I'd also like to offer just an analogy and a simple way to maybe help you think about this so that you're not overwhelmed and it's what can I do? You know, I carry in my car at all times a first aid kit. I suspect many of you do as well. And the idea of this kit is it's great if there's bleeding, if there's a cut, a scrape, a minor injury that can be dealt with. Somebody run to the car, grab the first aid kit, put a Band-Aid, you know, simple low-level kind of injuries. Well, I'd like you to stay with that idea and say, what would a mental health first aid kit look like? What would be inside of that kit that if something happened, you would be able to know what to do and how to best respond in the moment while it is occurring? And I'd like to give you just a few quick things. The first relates to an earlier point. Make the judgment, is this a crisis situation? Is there imminent danger for the person who's having the crisis? Is there imminent danger for their loved ones, family members, or nearby persons? Those I know are quick judgments, but we're talking about safety of body. We're talking about any physical risk of anything or anyone nearby. That's a quick judgment. If it is a crisis situation, that is when you call the crisis hotline number at the number that I gave you. And literally, great news, they'll walk you through it. They will make additional contacts if that's called for in that situation. So the first thing, make that judgment. Is it a crisis? Is it not? The second is, I'm just going to give you a way to think about this. When a crisis is occurring or a mental health challenge is happening, you want to think of how do we move the person and ourselves and others from vulnerability to safety. And in some cases, it literally can be having other people nearby move out of the space. In some cases, it might be entering the space in a particular way with the person that's going through that breakdown or that crisis. So that idea of what does safety look like and what that evolves into is having a safety plan. That when we know this is part of our illness and part of our family story, then what we can begin to do is to say, okay, what's a safety plan for each person in the family? So when that happens, we don't have to be shocked and, oh my God, what do we do? Which it is very scary. We instead have a plan, everybody knows their part, and the plan kicks in. And again, I know that both from personal experience in my own family, but also from my professional work. It's a good idea to have, and it allows people in a hard situation, they already have practiced and they know what to do. And that alone can really give people a sense of calm, of okay, we can handle this. And then lastly, I would just give you a way that this comes from the background of dealing with people who have experienced trauma. And trauma, you would be not at all surprised, has a direct link to mental health challenges. It is not the only thing, certainly. There are many reasons that cause mental health challenges and serious mental illness. But trauma also often is part of that package. And while I'm on that point, you want to pay attention and realize that serious mental health issues and or serious mental health disease is not just an individual thing. It's a family thing. It affects every member of the family. It's an important reason why we do want to address it and not let it go untreated, because literally it spreads and harms others. And I know none of us want that to happen to those we love or frankly to anyone else. So this last concept would be this: listen, honor, and connect. So the idea would be when that person is having a difficult time, and let's say it's not a crisis, which thanks be to God most of the time it is not, but there still can be very serious mental health challenges. And that idea of listen, honor, connect, please notice the order of that. So the listening part is giving our full attention. What is that person feeling? What are they thinking? So that they know we're not judging them, we're giving them our full attention, which in the moment as they're dealing with mental health issues, that is an amazing gift. Just like you and I may have doubts and questions about that, the person going through the experience, either ongoing or occasionally, they too have those questions and doubts. So to give them our full loving attention is a wonderful thing to do. And then the honor part, so it's in order, listen and honor. Honoring means letting them know that we hear, see, and attend to what they are saying. So that we're not debating it, we're not telling them they're right or wrong, we're not judging them, we're honoring them. And they know that we hear what they say, we sense what they're feeling, we affirm what they have said to us, and frankly, the courage that it took them to do that. So listen and honor. The connect part is that part that doesn't always happen immediately, but the connect part is what's next. How can I help you? What are you thinking about doing about this now that we know we're dealing with it? Now that you know you're dealing with it. So that idea of listen, honor, connect, in that order. We don't just jump from listening to connecting of here's what we do next, because they don't know that we've heard them. They don't know that we've acknowledged the pain and experience that they are going through. That may seem small, but it's a huge step when it is done with empathy, because they know we understand what they feel, what they are going through. And the connect is that what's next step. What I'd like to finish with is I'm a Pittsburgh native, and one of my heroes is Mr. Rogers, because Mr. Rogers is Mr. Rogers. How could you not love the man? And at one point in his career, somebody said, you know, why are you making your whole career, your whole life about children's television for 3, 4, and 5-year-olds? You have so much more talent and there's so much more that you can do, and you're doing that? And it was fascinating because Mr. Rogers thoughtfully said, thank you for the question. I need to think about that. And he took a moment, and his answer, I think, is very telling. Here is how he responded. Every person needs to know that they are loved and that they are capable of loving. You can't learn that alone. We can only know that with each other. That is what I am doing, and that's what we are doing, and that is what my life is about. What a beautiful testament of what we can be with and for each other, that we can love others and help them know that they too are capable of loving. And that is a gift that will help the mental and spiritual and physical health of all of us. God bless you, and peace be with you.